Hi, I'm Dr. Christine Ortner, and the purpose of today's video blog is to help you prepare a medical directive for your pet so that when you're out of town, your wishes are known and your pet can receive the care that you would like them to have in an emergency. So what I'd like to do today is first go over a pet sitting consent form that I've created that will help you outline your wishes for your pet for their medical care. And then secondly, I'll go over some cases as examples of what could possibly happen when you're out of town. I've been a veterinarian for 20 years now, and I've had many of these cases, and it can be very stressful to have an animal present in a critical situation and not be able to reach the owner and know what they'd like to have done. So I'm going to help you prepare for that for your pet. So if you go to our website, www.cascadesummitvets.com, and go to the links section, there's a tab on the side for links. You can find this pet sitting consent form and fill this out completely before you leave town. And I'm going to review it with you now and help you fill that out. So first, you'll have your name and address and the best way to reach you. I had an owner in Paris, and we were actually able to reach them through Skype when their pet had an emergency. So that may be one way to reach you, especially if you're out of the country. The expected dates of your absence, and then what would be very helpful is if you assign an agent other than yourself who we can reach in case there's an emergency. For me, that would probably be my sister. She definitely knows my wishes for my pets, or a trusted friend, but have their name and contact information on here as well, and make sure that they are clear as far as what you'd like to have done. And then their information, and then very importantly, we're going to need a form of payment. For my clients that I know well, it wouldn't be such a big deal. I know what their wishes kind of are and how much they'd be willing to spend, but it might not be me. Your pet might be going to the emergency clinic, and before they're going to perform a very expensive procedure, they are going to require some form of payment. And best case scenario, the person who is there has a credit card with their name on it that they can use with that credit limit available. Some clinics will take your card with your name on it, but if we're going to do that, you're going to need to write that down here and sign that we are authorized to use that card and the amount that we can use, because that can become kind of a sticky situation. So going down further, I actually spelled out what type of care that you would like for your pet. How far do you want to go? How much do you want to spend? It varies from client to client and situation to situation. Some pets are much older and have other health problems, and you may not want to go as far. Other dogs may be younger and healthier, and you would want to do more for them or spend more in that situation. So it has to be very clear. Would you want just an exam and maybe some diagnostics? Would you authorize anesthesia if necessary? How about surgery? Would minor surgery like laceration repair be okay? Or what about really invasive surgery, such as a twisted stomach surgery? That happens quite frequently when animals are stressed, and when you're out of town, they're stressed. And so that one comes up pretty often. And then, unfortunately, there are those situations where you're out of town and your pet is incurably suffering. Maybe its kidney failure has gone into a crisis, and we know that there's no hope for them, but we can't reach you. In that case, do we have permission to perform euthanasia? And that has happened to me actually very recently with a patient, and it is very important that I have your authorization to do that if necessary. So let's see what else here. So that part is right here on the bottom, that you would give consent for euthanasia if absolutely necessary. So do go ahead and read that as well. And then on here I have the names and addresses of my clinic and 2 closest emergency clinics. But if you're watching this blog and you're not in this area, just list your clinic and the closest emergency clinic so your pet sitter knows where to go. And then just to review one more time, how much you'll put down for your financial limit, just to give you an idea of what can happen. If your dog, for example, does twist its stomach, and that happens more commonly in large breeds, but yeah, it can happen in small breed dogs too. That is an emergency. We have to be in surgery very quickly to untwist the stomach in order to save the pet, and it's going to cost about $3,000. So for me, when I fill out this consent form for my dog, and she is a larger breed dog, she could twist her stomach, and I put how much the veterinarian can spend, I personally put down $5,000 because I know that will be enough to save her life if I cannot be reached. And if something happens and I'm on a plane between here and Atlanta, Georgia, where my sister lives, that's a 5.5 hour flight. And if that happens during that flight, she will need surgery before I can be reached. So $3,000 will cover a lot of emergency situations, at least get them started. But if you would not want to do that, for whatever reason, your pet is older, has other health problems, you would not want to pursue that kind of extensive treatment, that needs to be clear, because the veterinarian and the pets there will have their hands up and say, we don't know what they would want. So it's really, really important that we know exactly what your wishes are. So if you want to be very, very prepared, one of the best things you can do before you leave to go out of town is bring your pet in for an exam, especially if they're seniors. If it's been a while since they've had their lab work, I would suggest that too. So like my dog is 14. So before I would leave, right before I'd leave, within a week, no longer than 2 weeks before I leave, I'd bring her in, do a full physical exam, do her lab work, and see what is going on with her before I go. What can I anticipate will go wrong with her? If her kidneys are at all insufficient, when the owner goes out of town, pets tend to drink less, maybe eat less, and that minor kidney insufficiency can go right into kidney failure. So if you're not sure about your pet's current health status, before you go, have a checkup. And while you're here, one of the best things you could do to prepare would be to sign up for a 30-day free trial of pet insurance with Trupanion Pet Insurance. If we sign them up here in the office, there's no waiting period. And while you're out of town, if something were to happen and we had the pet insurance on file, a lot less to worry about as far as estimates and payments. We could just do what we need to do, file with the insurance, and proceed with whatever we need to do. So consider that before you go. Come in for a checkup. If you don't have pet insurance, go ahead and sign up for a free 30-day trial, and you're covered while you're gone. So that may be one of the best things you can do to prepare. So if you'd like to continue watching this blog, I'm going to give you some examples of cases that I have personally seen that a pet sitting consent form would have been very helpful. So we talked about the twisted stomach. One of my cases this year was a 9-year-old golden doodle who did twist his stomach. The owners were in Paris. And their daughter was watching a dog, and she thought, yeah, I think my parents would want to have the surgery done, but we weren't exactly sure. We tried to reach them by phone, couldn't reach them by phone, and luckily we were able to reach them via Skype, and I did give permission for the surgery, and it was very successful. And then we think about older animals having problems, but I did have a 6-month-old golden retriever puppy come in a life-threatening situation. He had had some allergic reaction to something he was chewing on at the boarding facility. His throat swelled shut. He could not breathe. I could not pass a tube past his swollen epiglottis and had to perform an emergency tracheotomy to give him a temporary breathing port. And I could not reach the owners. And I knew this was going to be a very expensive procedure, but he was only 6 months old, and I had to make a decision immediately. So I went with my instincts, and I did do the tracheotomy and sent him to the emergency clinic over the weekend for care. And when the owner got back, he was pretty angry, refused to pay the bill and said he would have not authorized that procedure. He would have put the dog to sleep and gotten a new one. So just situations like that. If I had known his wishes, it would have made the situation a lot less stressful. And then there are many, many cases. I could go over them for hours of animals that have been hit by cars when their owner's out of town. Often, whoever's taking care of them is not that familiar with their habits of maybe darting out the front door, or if the pet is staying with someone else, they might get out of their door or out of their yard and immediately into the street, and there you go. And that can be anywhere from a $200 laceration to a $3,000 situation. And so it is critical that your wishes are known as far as how far you would want to go. And again, that is based on a lot of things, and it changes year to year. You might fill this out this year, but then next year your situation, your pet situation may have changed. So it'd be really good to go ahead and update that each time before you go out of town. And if you do have any questions, would like to talk to me about this any further, I'd be happy to speak with you. You can email me. It's on our website, or give me a call. And I would love for every single pet owner to have this in place, because emergencies are never expected. Do this for yourself and for your pet. That way, the next time you go out of town, you'll have more peace of mind. I hope this helped.